Hello everyone, today we're going to be doing the long-awaited jaw surgery Q&A where I answer your guys' most frequently asked questions. If you don't know me, hi, my name is Danielle. I got jaw surgery this past summer and I posted my recovery process online. So let's get started. The most commonly asked question was why? Why did you get it done? So to simply put it, I had an underbite. And for those who don't know what an underbite is, basically, when you bite down, your teeth should go like this. But if you have an underbite, that's when your back teeth goes forward. My bite used to be where all my teeth were touching each other, but now it's behind. A lot of people are asking me about my braces journey. I only had to have braces for 1.5 years before the surgery, and that's because my teeth were just not that crooked to begin with. My dentist told me that I had an underbite, so in order to get that fixed, I should go see an ortho. So in middle school, I went to go see an orthodontist, and he was like, I don't recommend fixing the underbite now. I say you just wait until you're 20, 21 to get jaw surgery, and then we'll do braces then. So I got my braces the second year of college, which is January of 2023, and now it is August of 2025. So it's almost been 2 years now. And in order to get jaw surgery, you have to wait until your jaw is fully developed, which is when you're usually around 20, 21. Well, braces does not fix the bite issue. In order to fix it, you need headgear to either like hold your jaw in place or push it back, or you get surgery that would manually move your jaw back. And as for after the surgery, well, it really depends on your orthodontist, but my orthodontist said that I will be able to take it off before Christmas of 2025. Yes, I was wearing braces when I had my surgery. You actually need to have braces beforehand because that's what they're going to use to wire or rubber band your mouth shut. And for me personally, I was ready for surgery a year after braces because again, my teeth weren't as crooked, but that really depends case per case. Next, let's talk about everything surgery. When it comes to choosing a doctor, I would recommend getting a lot of consultations. I got around 3 to 4 consultations from different doctors who gave me different recommendations. One thing I do recommend is maybe looking for a doctor who's qualified in both oral and maxillofacial surgery, but also plastic. If you're curious, I went with Dr. Ozaki. He works at UCLA oral and maxillofacial surgery. Depending on the case and severity of your jaw, it might differ, but for me, a lot of my doctors recommended me to bring my upper jaw forward, and my ortho and a different doctor, they were like, you should bring your lower jaw back. So it was different, but in the end, I was the one who was able to choose which surgery plan to go with, and I ended up doing a lower jaw setback just because of the benefits that I'll get into later. And for cost, I'm very blessed that I have 2 insurances, and my primary is Aetna and my secondary is Anthem Blue Cross. I haven't gotten the bill yet, so I don't know if the surgery is free. If it is, bless up. But I know jaw surgery could range anywhere between 0 to 10K depending on how much your insurance is willing to pay out. And as for the surgery itself, you are asleep, you are under general anesthesia for the surgery, and my surgery was actually pretty quick. It was only 1 hour and 30 minutes. Now going into the actual recovery process, so many people were asking me what was the pain levels like. So immediately after the surgery, I woke up and I felt like I was beat up. My face hurts so much. Like, it's a feeling that I've never felt before. The nurse asked me like, what is your pain levels like? And I like signed to her. I was like, it's an 8. But it genuinely felt like a 10, but I was trying to, thug it out. So then she gave me Advil, and that completely knocked me out. I was so tired after. But pretty much after the first week, I didn't have to take the pain medications anymore because it was just slightly uncomfortable, but it didn't hurt. And for the medication, I was prescribed antibiotics, oxycodone, and Tylenol, and these are all like really strong pain meds. My face was super bloated right after surgery. It looked like I ate like a baseball. For some reason, only half of my face was super swollen and the other half wasn't as bad. I would say I was really swollen that first week. The first 3 days are probably the worst when it comes to swelling. Like everything just keeps getting bigger and bigger, and then the swelling starts gradually going down starting like week 3 to 4. Currently, I'm week 7 post-op. So right now people are asking like, oh, is this what your face is gonna look like long term? In order for your face to look like normal and like what you're gonna look like for the rest of your life, that takes around 6 months to a year for the swelling to fully go down. I would say it hurt the most at nighttime, especially because that's when the pain meds started to wear off. So I would recommend eating your painkillers before you go to bed and and then as soon as you wake up, eat breakfast and then eat your pain meds. I think I looked pretty normal starting weeks 5 to 6, so just keep that in mind when you're planning your surgery. As for numbness, your whole mouth isn't numb. Right after I woke up from surgery, I felt everything on my left side of my face, but then the right side was the issue where I don't feel like my lip or my chin area. Like this little section here, I don't feel anything, but the numbness has started getting better. Like I talked to my doctor and he said there was no complications. He said I should regain full function in my mouth area. It's just because like when you're in surgery, that nerve that runs across your lower jaw, it gets stretched, it gets pulled. So there's a high chance of numbness, but you should be able to regain a full recovery if the surgery went well. Starting week like 5 or 6, I started feeling a little bit more like you get like tingling sensations, which means that the nerve like endings are like coming back and they're like functioning again. But right now I would say I have like 30% feeling in my lip and my chin area, and I think it'll just get better as I go on. Some people don't regain full recovery until like months after surgery, so I'm not too worried. And when it comes to mouth hygiene after your surgery, the first week I did not brush my teeth, and I know that sounds gross, but that's why for me getting a water flosser, it saved me so much, because since you're not able to physically use a manual toothbrush and like get all the nitty gritties, shooting water will help get all the food and gunk out. And I like it because the first couple days like there might be a little bit of blood in your mouth still, so it just flushes everything out. And I know some people use mouthwash. I personally didn't use that because I already had like the water flosser. But as for brushing your teeth, after the first couple days, like my mouth felt really disgusting and grimy. Like it felt like there was a film on the backs of my teeth, and I could feel it every time I like moved my tongue around. So what I would do is, since my teeth were rubber banded shut, I would shove like a manual toothbrush inside, and I would just brush the backs of my front and back teeth, and then I would also brush like this way. But I wasn't able to go inside the molar and get all the back teeth because everything was too puffy. I don't think you're supposed to do that, but that's what I did. So yeah. And then by week 4 and 5, I would completely take off the rubber bands and start brushing normally. Now, when it comes to sleeping after your surgery, for the first week, you should not be sleeping flat on your back. You should be propped up by either pillows. I have this like massive giant pillow that I always slept with, and it is really uncomfortable just because like you're not used to sleeping up straight. But at least for the first week, I recommend doing that. And then by weeks 2 and 3, I was like getting sick and tired of sleeping upright, so I would just sleep on my back. And you shouldn't really be sleeping on your sides because you don't want to put any pressure on your jaw. Ice packs are going to be your best friend, especially that first week. I always had an ice pack attached to my face, and I got this like little contraption from the hospital that's basically like a cloth with 2 ice packs on the side that I would just tie around my head, and I had that on at least like 18 out of the 24 hours of the day. And then I would just constantly switch out the ice packs. And then by week 2, I started using heat packs. So what I would do is I would just get like a really long sock, fill it up with rice, and then microwave that rice and put it on my face. Eating certain foods definitely helped. I ate a lot of pumpkin porridge, and in Korean culture, like it's a very big thing to eat pumpkin to help with swelling because I think it has a lot of like anti-inflammatory properties. So eating that as well as pineapple juice. So I made pineapple smoothies. Oh, and also I would recommend going on daily walk. Even right after the surgery, I would at least try to walk around my neighborhood for 15 to 30 minutes just to help reduce with the swelling and also get some exercise in. As for essentials, I would say baby spoon, because your mouth, the gap between where your rubber bands are and the space between like where the food could go, it's pretty narrow. So I would say using like a baby spoon, that was definitely really helpful. And also I got like these syringe things from the hospital, so for the first couple of days it was really convenient to drink liquid out of that because I would just like push it into my mouth. And no, my mouth was not wired shut. I just had 2 rubber bands that banded my teeth together, and then every week I would go see my doctor and he would change out those bands. Yes, I ended up losing 10 pounds. I honestly was not that hungry during my recovery process because just eating was a lot of work, which is why I think I lost the amount of weight that I did. But for the people who are concerned about losing weight, I would just recommend drinking a lot of protein shakes and also bulking up before the surgery so you have that wiggle room to lose weight. As for the food that I ate a lot of soup, yogurt, and my mom made a lot of like Korean dishes. So one of them was soft tofu. You could get them at the Korean market. It's like really soft, so it just dissolves in your mouth. And then she would season it with like soy sauce and sriracha and furikake, so it adds more flavor. You could go to my shorts or you could go to my reels or TikTok page because I have all my post-op meals posted there. Right after surgery, it's really dangerous for you to throw up, which is why they prescribe you anti-nausea meds. And right before the surgery, my anesthesiologist, he came and talked to me and he was like, do you want really strong anti-nausea meds because you might get like dizzy after the surgery? And I was like, oh, I'm okay. I opted out, but you could definitely opt in. And now let's talk about the results. Yes, I'm quite happy with how it came out. Honestly, for me, it wasn't that big of a change. So I didn't really have an identity crisis. I know some people are worried about it, like, oh my gosh, my face is going to change so much. But that's why it's really important to talk to your surgeon about how your face is going to change so you could kind of expect these type of changes. For me, I would say the biggest difference that I saw in my face was my face got a little rounder and also a little more shorter. So before, when I had an underbite, this chin part was a little longer just because it wasn't aligned correctly. But now that my teeth are behind my front teeth, this part is a little shorter. And also the swelling hasn't completely gone down yet, but before I used to have a lot more of a V shape, but now it's a little bit more rounder. And as for before and after pics, so I'm going to put up some pictures. And as for my profile, so if you could see, my jaw definitely did go in. And I wasn't that worried about the facial changes that I would have to go through just because I had a long, extensive talk with my orthodontist and my surgeon about how my face would change. So I kind of knew what to expect. And I chose lower jaw surgery for myself. My case was pretty minor. They were like, you could either go upper jaw forward or lower jaw back because it's only a few millimeters change anyway. So it was up to me to choose. And after doing some pros and cons, I decided to choose lower jaw. For the upper jaw, if you were to get it done, it would improve the mid face. So if you could see like my side profile, my cheeks are a little flatter, but I think that's pretty common for Asian faces compared to Caucasian faces where theirs is a lot more plump and rounder. So that wasn't something that I was really that like, oh my gosh, I really need to improve that. The major concern of my orthodontist and why he really pushed for doing a lower jaw setback is because he didn't want the base of my nostrils to get wider. In the case of if you do bring the upper jaw forward, there is a chance where your nostrils could get slightly wider just by a couple millimeters. It's not going to get like super wide or anything. If you're worried about your nostrils getting wider, don't worry. A lot of surgeons, they do something called the Ehler base cinch where they put stitches right here on your nose so it could hold it in place while you're recovering. However, when I was talking to surgeons, they really recommended doing upper jaw instead of lower jaw because it is more common than the upper jaw where people don't regain full like functionality and just like the feeling in their lower jaw. But that pretty much concludes my jaw surgery Q&A. If you have any other questions, please leave them in the comments below and I'll make sure to try to answer it. And thanks so much for watching. Bye!